Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. Traumatic injuries include everything from falls and car, motorcycle, and ATV crashes to gun violence. With warmer weather on the way, more people will be headed on road trips and they'll be out enjoying nature on bikes and ATVs. Inside the house, fall hazards can abound, especially for older adults who are more prone to these injuries. So today, we're talking about preventing traumatic injuries by staying focused and staying safe inside and outside the home with Dr. Alison Wilson, Executive Chair of the WVU Critical Care and Trauma Institute. Welcome, Dr. Wilson, to Live Healthy West Virginia.
Great. Thank you very much. I really appreciate this opportunity.
Yeah, we've got a lot of good information to cover today.
Yeah.
All right. So let's just get started then. Let's start with what exactly is a trauma center? Because I think a lot of people get confused. It's not the same as the emergency department, right?
That's correct. Yes. In fact, it is a big point of confusion for many people. The trauma center is a comprehensive center. So it covers not only what happens in the emergency department, it's all the specialists and subspecialists, as well as the trained nurses, therapists, and others that are required to take care of a patient who is traumatically injured. And it continues not only through the acute phase of the injury, but also through their hospitalization, any operations, all the way through rehab, and now really starting to focus on getting that patient back to their life and back to all their activities that they used to do as well. So it's reintegration into their home society and communities, well after they've recovered from their injuries.
So from start to finish.
Start to finish. So there are different levels of trauma centers.
Yeah.
So there are 4 different levels of trauma centers. In West Virginia, we only have 2 level 1 trauma centers in the whole state. So it really is an important aspect to have.
What does that mean to be a level 1?
Sure. So a level 1 trauma center means that they are designed to take care of all injuries of all complexity and really specializing on the severely injured patients. So it's very important that our community hospitals have those level 4s, 3s, and 2s to provide that initial care in the emergency room to help stabilize them and identify those who are significantly injured so they can get to the level 1 trauma center. A level 1 trauma center requires that we have 24/7 access to trauma surgeons as well as complex orthopedic surgeons, hand, facial surgeons, neurosurgeons, and others to help support the multi-system injured, as well as have all the medical subspecialties to help care for patients when they have comorbidities as they get older.
And the WVU Critical Care and Trauma Institute is level 1 and level 2?
It's all level 1. So
all
we are
level
level
1. Okay.
1. Well, we are a level 1 adult. We are a level 2 pediatric. There are no level 1 pediatric centers in the state. However, I'm excited to say this year we have our application in to go to that next level and be a level 1 pediatric trauma center as well.
Wow.
That would put us in a group of less than 40 centers in the entire United States that are pediatric level 1 centers.
Wow. And I'll bet you'll do it. I know you will.
We will, no doubt about it. So,
I know you will.
No doubt about it.
So let's talk a little bit about traumatic injuries. What are the most common traumatic injuries that you see and treat?
Overall, the most common traumatic injury that causes significant injuries in the entire United States as well as in West Virginia are falls. So that not only includes falls from ground level, which afflict many of our older and geriatric population, but also in West Virginia, nothing's flat. And so people are really good about falling from different levels, heights, whether that's within the home, whether it's putting up decorations, or when they're traveling and enjoying things, outside, when they're deer hunting, falling out of the tree stands, or just falls and down our terrain.
And what type of traumatic injuries do falls usually cause?
In the geriatric population, it's a lot of fractures and hip fractures, which may sound like it's a small issue. However, the national data is that 50% of patients who develop a hip fracture that are geriatric patients have a risk of mortality within 3 years.
Oh, wow.
So it's really important. It's a time for us not only to intervene on that injury, but also to intervene with those patients as to the cause of their fall. And is there anything that we can do in the home to help keep them more safe or to increase awareness and decrease the potential fall hazards?
Okay, well, that makes a lot of sense. Are most, if not all, traumatic injuries preventable, or am I just being really optimistic?
I would say most, definitely not all, but most have a source that we can look back and say that was the hazard that ran into that. There are certain things we can do to mitigate different types of injuries, and there are safety measures that we can take so we can enjoy this wonderful state, but decrease our risk of injury while we are enjoying it.
Okay, so let's start talking about some of those injuries and how to prevent them. Prom and graduation season.
Yes.
How can our kids celebrate safely?
Yes, this is always very, very important. And the number one thing that I would encourage for young people is that when you're in a vehicle, wear your seatbelts. That is the most important. Avoid texting and driving. We know that it happens all the time. In fact, we published a paper several years ago looking at college freshmen, and 95% of them reported that they texted and drive. However, it was interesting, more than 75% reported that they felt very, very unsafe when someone else was in the vehicle and they were texting while driving. So it certainly is a distracted driving can be a problem. Well, not only can be, it is a problem.
Yeah.
So minimizing those distractions while that you're driving. And certainly I would be naive to say that, kids don't drink while they're out at some of these events.
No.
Right?
No.
But, really think about having a designated driver. And I would encourage all the young people, if you're in a situation and your designated driver, you don't have one or whatever, your parents or a loved one will always be happy to come get you. Right.
That's what we always told our
that,
kids. Yeah.
Right. It's so important. And every parent would far rather have that phone call saying, please come get me. The designated driver didn't sort of follow the rules, then get a call from my center saying, please come meet us at the hospital.
Oh, gosh.
So those are I think are the most important. And then also be smart about where you're going, what you're doing, and who you're with. Right. So those are always important things too.
Does focus have anything to do with this?
Focus definitely has things to do with, and again, that goes back to the distracted driving. Certainly, the number one thing we see around graduation and that we see around prom are motor vehicle accidents, unfortunately. And so a lot of those are preventative if they're focused on their driving at the time. And if they're not on their phones, and save that text for later, have someone else do it, or do the voice to text now, which is so ubiquitous in our community.
Sure.
And then avoid the drinking and the substance use while you're driving.
Okay. Good advice. Good advice. Okay. ATVs, they're really popular around here. So what are your safety tips for ATV drivers?
Yes, ATVs and UTVs. So
what's a UTV?
A UTV, yep. So an ATV are those four-wheel quads that look like a motorcycle that you sit on. The UTVs are like the Polaris and the Rangers that are the super souped up, I wouldn't say a golf cart, but those off-road vehicles. Yes. And people assume that they're always safe because they look more like a vehicle and have a cage. The reality is that, again, terrain is not very stable around here, and you're having a good time and you use them for off-road things. So just because there's that cage doesn't mean that it keeps you safe. And some of our worst injuries have happened on the UTVs. So when you're riding on those vehicles, be sure, again, avoid any substance use and those things. 2, focus on where you are. 3, be careful with the ruts, because you may hit a rut and that'll cause the vehicle to roll. What we see a lot of times in those injuries are facial, head, chest, and extremity injuries. So keeping your extremities inside the vehicle, they all have netting that's made for safety. Put those up. It takes an extra second, but that helps keep your extremities inside and avoids a crushed extremity. And then again, they all come with seat belts, so wear your seat belt.
Why wouldn't you?
Well, I think some people think it's not cool or not as fun, or they underestimate it or think they're not needed because of that roll cage.
Yeah.
But when they fall out and they don't have those seat belts on, then that roll cage falls over onto their chest or onto their face and really causes really severe injuries because they're so heavy. Now, the ATVs, the things, those are open air.
Yeah.
Those, again, be smart about the incline. Be careful with the ruts. Think about your speed. But then also remember that those are made to turn a certain way so that you shouldn't lean in. So unlike a bike or a motorcycle, as you're turning, you lean into the turn.
Yeah.
On those, you have to lean out. So that helps keep the balance. It's really important, and I would highly advise before you get on those, take a safety course so you really understand how they work, and then really be sure you're matched with the appropriate sized ATV. So there are adult-sized ATVs that people ride that unfortunately we see a lot of kids get on. Those ATVs are too big, and then they tend to lose control. And when those roll over onto a child, certainly the weight of those machines can certainly cause severe, just life-threatening injuries. And in fact, within our population, we're one of the leaders in the nation of mortalities in children from ATVs. So I really advise, and then of course, always, always, always wear a helmet, even more so than I think many other activities. The helmets really decrease the severity of injuries when riding the ATVs.
Like a motorcycle.
Just like a motorcycle. In fact, I think that the ATVs have potential for worse injuries because you are off-road, and because people a lot of times don't have as much experience and it's not as intuitive, I think. And people tend not to wear the helmets for whatever reason. So wearing the helmet is so important.
All right. Good advice. Good advice. Okay. Swim season is already underway. How do we prevent drowning and diving accidents?
Yes. So unfortunately, tragically, we oftentimes will get 1 to 2 patients per month during the summer that have devastating spinal cord injuries after a diving accident. So the biggest thing is you have to know the depth of the water and don't dive into shallow water. And where this really comes into play isn't so much in our public pools because they do a great job of having the lifesavers and watching those, but it's out in the fun places, in the rivers and some of the other areas. Swim holes, which are great. They're really
swinging
refreshing.
Out on the rope. And,
So feet first, always, right? Feet first, especially because you don't know the depth. And one day the water may be higher or lower than what you think, even though the surface may look the same level. So feet first always when you're diving or going off the swings. And then as far as the swimming and things or the whitewater rafting, life jackets, of course, and a helmet to avoid the head injury. Avoid getting your foot down when you're whitewater rafting so you don't get your foot stuck into any of the rocks. And then when you're swimming, swim with a buddy. Swim with a buddy so you have someone there, and avoid swimming when you're intoxicated or using any other substances. I think those are the leading causes we see in drownings. For the children, it's really important. Supervise the children. If you have a pool at home, be sure that you have fence and gates that the kids can't get in.
That's right.
That's so important. It only takes a few seconds for a kid to be out of your sight for them to end up in the water. They're naturally curious, and warm water drowning in a pool usually has a devastating outcome. So please watch the children. Fence and gate your areas around your pools, and always make sure they're supervised. And swim with a buddy.
Yeah. A lot of this is common sense, but we need to hear it.
We need to hear it, and then we need people who are comfortable when you're in the situation to speak out and say, hey, let's maybe change what we're doing, or have that influential friend or buddy who says, hey, you need to put your helmet on.
Yeah.
Right?
Yeah.
And my kids are always, oh, Mom, why are you doing this? But when we get in the car, I don't start the car without everybody's seatbelts on. And as a teenager, there were times when we just sat in the car for a while because I did not go anywhere until their seatbelts were on.
That's a good rule.
Yep.
That's a good way to do it. And then, of course, 4th of July, good old fireworks, right?
Yep.
It's a lot of fun, but so much can go wrong.
Yep. So 4th of July is a great time. Home fireworks, and we have a lot of those in the area, is super fun. I do it myself, right? You want to be sure that you have a safe radius from where you're lighting it off. You want to know the conditions and make sure that it's safe to do that to avoid causing a fire.
Yeah.
Right. Make sure you're far away from any fire pits or burn pits, right? Because you don't want anything to inadvertently happen. Or you also don't want, as you're trying to walk away from where you set the firework off, to trip over the fire pit or the burn pit.
Oh, yeah.
Right. So we've had patients who they were running back after lighting the firework, and then they trip and then fall into the campfire.
Oh, my gosh.
So you want to be careful about that. Again, be careful, avoid intoxication, right? So that's something that's important. And then the injuries we see tend to be extremities, and they tend to be, hands as well as face and eyes.
Oof.
So for the adults lighting the fireworks, again, safe distance away from the people that you're watching it with. Make sure it's in an area that you can easily get away from it with level ground, right? And then be careful and smart about the fire source you're using. Be rational about how many you can light all at one time.
That's a good one.
Right? Because you always want the big spectacular boom, right?
I know that sounds like from the files of Duh, but I mean, you have to talk about that.
I have to say, having been tempted myself, I know I can light this one more, right? And then for the children, we all love the little sparklers and the poppers.
Yeah.
So you can get like a little plastic guard to put over their hand. Again, watch them closely to make sure they're not putting sparklers close to their face.
Yeah.
And then children sometimes have this, especially little boys, because little boys come out of the womb trying to self-destruct.
That's right. You don't have to tell me.
Right. So they'll want to take the sparklers and then pretend they're swords, right?
Yes.
It may be cute in the moment, but don't let them do that, right?
Yeah.
That's surely a setup to get burned. So keeping them far enough away, watching them, supervising them, only letting them have one at a time. Those are things that you can do to keep your kids safe and enjoy those activities.
What's a good age to let kids have sparklers?
Well, that's a good question, right? So I think it really depends on the kid's focus and maturity.
Yeah.
So if the kid can't sit there and read a book, or the kid can't follow more than 2 to 3 instructions in a row, they probably shouldn't be handling a sparkler. They're not ready. So I don't think it's so much a chronologic age. It's that ability to focus and follow directions, and maintain that focus for that 2 minutes that the sparkler would be lit.
And that's what all these tips are about, is staying focused on everything around you, and
it's that situational awareness, and it requires that the other people also have the situational awareness about the potential hazards. And then for the adult or for the teen or whomever, it's that ability to speak up when we see someone starting to take on a risky behavior.
Something dangerous.
Yeah, I fear that people, we've gotten so passive as a society. Let you do you and I'll do me, right? But at the same time, I think there's a lot of regret then when somebody didn't speak up and then something happens.
Yeah, somebody has to be the voice of reason.
Yeah. And maintaining that situational awareness of potential hazards, right?
I remember my sons when they were teenagers. I mean, they all had that one friend that was the voice of, and that was the one I wanted them to hang out.
Yep. That's right.
Go with that guy.
Yep. Well, everyone jokes with me because I had certain things that I know my kids well and know which ones are a little
Yes.
more impulsive than others.
Yes.
And I was like, look, I'd much rather have you ride a dirt bike, because if you flip that over or crash it, your chance doesn't get as high a speed as a motorcycle, and it's not as heavy as an ATV. So they always argued. They were like, Mom, why are you okay with me riding a dirt bike, but you're not okay with me riding an ATV?
Yeah.
And I was like, because I know you and you're going to crash it. So I want you to crash something that you're going to walk away from.
That makes sense.
Yeah.
It makes sense. How about motorcycle safety? Now, this isn't just for the people that are on the motorcycle. It's for all of us driving on the road with the motorcycles, right?
That's right. That's right. So awareness, nowadays, so many people have those, the mirrors that have the little icon that lights up, but sometimes those don't necessarily sense the motorcycle. So you still have to really be vigilant to always check your blind spot, right? Motorcycles can come up very quickly, and it's maintaining that awareness. And sometimes people do risky behaviors on the motorcycle, weaving in and out of traffic, so it doesn't follow, predictable flows. And so you always have to be aware, because you definitely are going to win if you're in a vehicle and someone's on a motorcycle.
Yeah.
Now, if you are the motorcyclist trying to, again, ride with a buddy if you can, that's always safe. However, please, please, please wear the protective gear. And of all the gear, the helmet is the most important, and preferably a full face helmet. I know there's a lot of controversy about helmet laws, but I can't tell you how many people could have survived their injury that have a devastating brain injury, that either die or have lifelong disabilities then because they just simply didn't wear a helmet. And I know
they've had the no helmet law in Pennsylvania for like 10 years, and that still freaks me out when I see them.
Yes.
Wow.
Yeah. And I see people, as soon as they cross over the border into Pennsylvania, take their helmets off. And I just think it's a tragedy, because if you've been on that other side where you've had to deliver the bad news to the family, it's just catastrophic. And it only takes a second. And even if you think you're riding safe, you don't know that other people can always see you.
Yeah.
So please, for the love of your family and your children and your friends, wear your helmet. Everything else, we can usually fix everything else. The thing with a trauma center, we have over a 98% survival rate if you make it to your level 1 trauma center.
Wow.
Yes. So, we can fix the other things. You might be broken for quite a while, but, the devastating brain injuries will limit you lifelong. And that's the number one thing.
Wow. All right. That's one we're definitely going to remember. How about avoiding car accidents? I mean, we talked about it a little bit with prom safety and distracted driving.
Yes. And I think one of the things that is really unfortunate is that driver education has been taken out of mandated things for most schools.
Yeah.
I think that those, as you have an emerging teen, putting them into a driver safety, driver education thing is a program, is a good start. It gives them that situational awareness and foundation. One program that we do have for the high schools is that we do come with a driving simulator. And so we can have them simulate what it's like to have those decreased reflexes or distracted driving. So one program we'll do is have them look at their phone and drive on the simulator so they can see and really appreciate how hazards can come in quickly without putting people at risk. So again, avoiding distracted driving, put that phone down for a bit. The other thing too is just that situational awareness. Leave enough parking or enough stopping space behind the car. Remember, ideally you want to keep, at least be able to see the bottom of the tires from when you're slowing down to come to a stop, the bottom of the tires of the car in front of you. Yeah. I think that's something we don't often teach. Yeah. Using your turn signals is also helpful, but the biggest thing comes from some distracted driving, impaired driving, if the drugs or alcohol use, and then speed. So think about speed and wear your seatbelts, right? Again, we know that seatbelts decrease injuries. And I've certainly hear people say, well, I had an injury from my seatbelt. Yes, after an accident, you can have an injury from your seatbelt. That means you were going so fast and that seatbelt worked that one, your head stayed connected to your body and you didn't go out the front windshield.
Yeah.
So, which is a huge injury.
Mm-hmm.
And two, it means that you hit with such force that, that's what caused the injury. So it wasn't so much the seatbelt. The seatbelt did its job and saved your life from either being ejected or having a terrible brain injury. So I push back on those who say, well, the seatbelt caused the injury. And then the second thing too is just being smart about the awareness of the conditions. So know the conditions, right? Be careful with the turns. We have some beautiful country roads and scenery. Just be smart about how fast you're going on those rural roads and anticipate the turns.
All right. Good to know. Okay, we talked a little bit about this at the top, falls being the number one cause. I also understand that that's the number one cause of concussion. Mm-hmm. People always think it's sports injuries, but more concussions come from falls, and especially among the elderly. Mm-hmm. So what can we do to prevent falls?
Yes. So let's break falls into a couple different areas.
Okay.
So there's falls from height. So such as being on a ladder. Right. So if you're putting up, the biggest time we see that is right after Thanksgiving, when everybody wants Pawpaw to go climb on the ladder to go put the Christmas lights on the outside. So, if you're, think about hiring somebody who has the appropriate safety equipment. If you are using a ladder, if you're painting, cleaning, spring cleaning, and you're using a ladder, make sure you're using the appropriate height and that it's grounded on level ground. Okay. So those are important things to know and think about. If you're up in a tree or you're doing, hunting and you're up into an area using the safety equipment, right? That's also very helpful to decrease falls. Again, avoid using alcohol or drugs when you're at a level of a height. So we all know that everybody likes to enjoy a cold beer, but cold beer then climbing up to work on the roof is a bad idea. Yeah. You're going to get to come see me. So we don't want that, right? So being smart about level ground, about the weather, and then making sure that you have the stability. If you're somebody and you're older and you have balance issues, now's not the time to ever get a ladder. Get rid of your ladders. So fall from height. Now, there's also a lot of fun recreational activities like mountain climbing and some of the hiking. And those, again, being smart about where you are, maintaining that situational awareness, and then always going with your phone so that you can call for help. Go with a buddy so somebody else can go and get help. Make sure you have appropriate sunblock to avoid things such as bad sunburns. We've certainly seen second-degree burns just from the sunlight. Yes. Wow. So people underestimate how a sunny day can really get to you. But I think the biggest thing is traveling with somebody and having a way to call for help. Those are the important things. Now let's switch to falls in the home. Yeah. So falls in the home are the number one reason that we see people, older patients and older people, then have a significant injury, and that can be orthopedic injuries like hip and femur fractures or rib fractures. And people underestimate the mortality and the outcomes after rib fractures. So not only can you end up with like a collapsed lung, but just the pain from breathing, then people tend to not breathe well. And when they don't breathe well and take a deep breath, then what happens is our lower airways can get collapsed down a bit and then fill with mucus. And then what happens is when you don't cough that up because it hurts, then you get pneumonia. And that's what people get sick from or eventually die from after rib fractures is a subsequent pneumonia. Okay. So we know that 3 rib fractures or more, or the inability to take a deep breath or cough, increases your chance of getting sick or even of dying of those injuries. So important to, seek medical attention if you're having those things. For the geriatric population, that's where we recommend coming to a trauma center because we have algorithms and multidisciplinary teams to help you with some of those breathing things that we can do that avoid just regular pain medicine. We can do different pain blocks. And then we certainly have our respiratory therapists who are a fantastic part of our team. As far as preventing falls in the home that avoid the orthopedic injuries, things that are way underestimated, preventative, know what your eye prescription is. And then wear your glasses. Mm-hmm. Keep your pair of glasses and have a spare close by where you tend to take your glasses off, right? Keep a little light on at night. So keep the area lit. Avoid the rugs. I understand they're pretty. I have some of those homemade rugs in my home to make sure they're secure. But after a certain age, if you're having issues with walking and picking up your feet.
If you're a shuffler.
Even if you don't think you're a shuffler, but your family's telling you you're a shuffler, right? Or if you just have a hard time keeping up with others, then that's a sign that you're a shuffler. Then go ahead and get those rugs up. So that's what we oftentimes see, are that people tend to trip over the rugs, or it's dark. And I know many senior citizens don't want to, quote, pay to keep the lights on, but a little night light really doesn't use that much energy. So keep the areas well lit, keep clutter away from the trip to the bathroom, right? That's another important thing. It's getting up in the middle of the night that tend to get people in trouble.
Sure.
Yep.
So tell me about the devoted and expert team at the WVU Critical Care and Trauma Institute. I mean, this is a calling, isn't it?
Yeah. No, I tell young people that want to go into medicine, I said, all of medicine is really, it's a vocation, right? Mm-hmm. It really means putting the well-being of your patients and their families and the community in front of everything. It really needs to be something that you really focus your life on. But I'll tell you, there's such deep joy in seeing someone come in, and in that moment having them be, they're very vulnerable, and then seeing them get better and getting them back with their family and getting them back into their homes, and then being able to see them as an outpatient in clinic and see them recover and get back to their things, and then getting pictures of them with their grandkids or them. It's such a reward. I can't even describe it. We're really blessed to have a great team at WVU. And it's not only the doctors, right? So we have trauma surgeons who are at the hospital, in the hospital 24/7. So we don't come in from home. We're always in the hospital. So dedicated trauma surgeons who have extra training and can manage all those injuries. We also have dedicated people who cover our intensive care unit. So if you require that level of care, we can do that. Our nurses are fantastic and undergo additional training to be ready to handle all types of levels of complexity. And then certainly our depth of our consulting services with some of our facial doctors. The ophthalmology department is fantastic. Things such as plastic surgery, reimplantation, reconstruction, orthopedic trauma, neurosurgery, and certainly our emergency medicine colleagues who partner with us. And I can't say enough about our specialized nursing teams and then our therapy teams, occupational therapy, physical therapy, our physical medicine and rehabilitation physicians. Our new rehab unit that we have in the hospital is just second to none as far as getting people back on their feet. But it's also the injury prevention. So I don't know that many people know, but we can come and do what they call a Stop the Bleed class for your community or church, where we can come and teach, hey, what do I do if somebody gets severely injured, and how do I stop bleeding? Because we know the number one cause of mortality in the early phase is bleeding. So we can teach that. We teach distracted driving. We teach a class called Trauma Nurses Talk Tough, where they can go to the high schools and talk to them and do simulations or walk them through activities on, hey, here's what can happen with bad choices. We have a whole program for seniors for falls in the home. We do vision screening on any senior that comes into the hospital because many of them don't even know they have visual impairments.
Wow.
So there's all sorts of things that we do, not
what
only.
Don't you do?
Well, that's a good question. The whole idea is to be comprehensive. We're not a burn center. But our goal ultimately is to become a burn center.
Oh, wow.
So we're working with the system to start to develop a plan to work toward that target. So,
That's excellent. That's excellent. So before we go, tell me, what is the most important thing you want our viewers or listeners to know about preventing traumatic injuries?
So I think number one, situational awareness, being willing to speak up when you see somebody taking an at-risk behavior. And then anytime you're doing something, if anything can distract from your focus of doing those things, put that off, right? So, have the beer on the safety of your sofa, So, and, think about what the secondary consequences could be of what it is you're anticipating doing. And be safe. Enjoy. We have such a wonderful state with so many great activities. I don't want you to be paranoid, but I just want you to take the certain precautions. And then as a final deterrent, just remember, when you come into the trauma center, we have a whole team that's there, but the first thing we do is we cut off all your clothes. So if you don't want to come in and have us all see you naked, then be smart and think ahead.
That's a good deterrent.
Yeah, that's right.
Well, thank you so much for sharing all this information. I'm hoping this will help us all have a safe, focused summer and inside and outside the home. Thank you.
Thank you. I appreciate the opportunity.
Well, that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information on the WVU Critical Care and Trauma Institute, visit wvumedicine.org/critical care. To find the latest episode of Live Healthy West Virginia, follow us on our YouTube channel at youtube.com/WVU Medicine and click on the Live Healthy West Virginia playlist, or follow WVU Medicine on Spotify to find this podcast and all WVU Medicine podcasts. I'm Mary Ravazio Menard, and on behalf of Dr. Wilson and everyone at WVU Medicine, thanks for joining us.